With the increase in hospital labor and delivery closures throughout the U.S., the lack of maternal health care is greatly impacting rural Americans. It can result in several adverse maternal and infant outcomes, including premature birth, low birth weight, out-of-hospital births, maternal and infant morbidity and mortality, and increased risk of postpartum depression. If the closest hospital does not offer labor and delivery services, a pregnant woman may have to travel to a different community many miles away to deliver her baby.
If that is what's keeping you from going in and checking on your baby, hours and minutes matter. Once you notice, go in, don't wait.
We have a solution.
He's wearing the cleats to help promote healthy pregnancy and prevent premature death.
From Sunday Night Football,
a free app a mother says helped save her baby's life,
to Good Morning America, the Count the Kicks program is making headlines.
We have a healthy baby girl and we could have had a burial instead.
Count the Kicks is an evidence-based stillbirth prevention program that teaches expectant parents the method for and importance of tracking their baby's movements daily in the third trimester of pregnancy. A study recently published in BJOG, an international journal of obstetrics and gynecology, shows the Count the Kicks stillbirth prevention program helped lower the stillbirth rate in Iowa by more than 30% in the first decade of the program. This happened while the rest of the country remained stagnant. How do we save lives? We host community baby showers, webinars, and trainings with partners. To break down barriers to access, our free app is in 16 languages with a new web-based kick counter and bands for moms who don't have smartphones. For these rural moms, Count the Kicks education and awareness made all the difference.
I want other moms to know that the importance of using the Count the Kicks app and how simple and easy it is to use to count your baby's kicks and monitor the amount of time that it takes your baby to get those normal kick counts. And I also want other moms to know that it's not just is your baby kicking and moving, but is your baby kicking and moving in the same pattern and in the same amount of time? Because had I not paid attention to that and mentioned something to my providers, Kembra's outcome may have been different because her kick count had changed. The pattern had changed. It was still a normal pattern, but it had changed from what was normally hers.
I want other moms to know that kick counting is one of the simplest things that you can do in a pregnancy, and it has great reward. Everett was born back in March when I noticed a reduce in his fetal movement, and his kicks were just not normal. And it's so easy, it's so simple to do, and it has brought so much joy into our life. So if I wouldn't have spoken up back in March when I was nervous about COVID and I wasn't sure what to expect going in for a test and having him early, we wouldn't have this joy in our life right now. So I would just like to encourage other moms to just take the few minutes, 10-15 minutes that it takes to kick count throughout a day. It's so simple and so worth it.
The free Count the Kicks app is a data download for mom's intuition. And when a baby's movement changes, time is of the essence.
If I hadn't been using the Count the Kicks app every day, I likely wouldn't have known that something was wrong. And we might not have known this beautiful, confident, vibrant little girl that we know today.
When you give the gift of telling someone about Count the Kicks, it costs you nothing but can truly save a life. One conversation can have a powerful return. You're affecting our trajectory in saving babies. There are more and more babies saved each year.
It's been a very impactful program here in the state of Iowa and certainly for our practice as well. I would ask all providers in the obstetric world, whether you're a generalist, OB/GYN provider, whether you're a midwife provider, lay midwife, otherwise, whether you're a high-risk maternal fetal medicine provider like myself, to take advantage of the information that Count the Kicks has available to you to provide your patients and help everyone decrease the incidence of stillbirth, one of the most tragic occurrences that we all have seen and experienced, because it's still happening in too great numbers. It needs to become a rare event.
Together, we can save babies and improve outcomes.